Good afternoon, one and all present over here. It is a lovely moment to start again the Empower Hour, what we have started since 2024 January. And today we are here with the Kerala chapter, and we are having eminent personalities from the diverse field, also a very significant person from the patient and patient family side. So so before going to the discussion, I just quickly would like to show the vision of ANEI, Association of Nurse Executive of India, established in 2017 with a vision to provide leadership, professional development, and research to advance nursing practice, nursing education, and patient care, while contributing effectively towards India's health goal. Mission to work with all stakeholders, establishing a national system for improving nursing scenario across India, thereby impacting patient safety and clinical outcomes in all settings of healthcare. I just highlighted the few words over here. Leadership, just to inform the new members who are not the ANEI member, in fact, that ANEI already been developing the module and conducting various programs on leadership. There are a lot of professional development for the continuous education and a session like this. And also we are having research fellows, research and to advance the nursing practice. And we are also have vertical education from the ANEI. And also we are proud to share that we are collaborating with the different organizations like CAHO, ASPI, Patient for Patient Safety, and also very soon we will be collaborating with the NAI. So just to tell about that, we are in number 800 out of 14 chapters, and we are having the membership. If you are not yet member, you can go to the www.anei.in. So quickly we can make by this year even the 1,000 membership that we are looking forward. So without mentioning this will be always, incomplete. The founder official who really worked hard to establish such a strong leadership association, I can say it is one of the best kind, I can say. And I'm lucky to witness that a founder member of this organization, and Madam Thangam Gomez, founder president, who is the CEO of Signia Healthcare, who worked hard from the very root until now. She is there as a backbone for us and leading from the front. And Madam Jyoti Clara Michael, she is also founder, national vice president, and still working with us. And Madam Subhadra Sagorikar, founder, national secretary, who was there and who is with us continuously. And of course, the very strong, dynamic, strong-headed person, Madam Captain Ajita Nair, who worked as a founder, national treasurer, now as a president. And this is the national officials for now. Madam Ajita Nair, National President, and myself, Dr. Unmana Borgohai, and Dr. Vinci Tibuban, National Secretary, and Lieutenant Colonel Dr. Aji Kail as a National Treasurer. So why we are working on the Empower Hour dedicated to the patient safety. We want to empower the nursing professional, but we are dedicating to patient safety, as patient safety is becoming a cause of concern, as the healthcare delivery is becoming very specialized and complex. Healthcare delivery requires coordination between the team members. Medical harm happens when this coordination lacks due to communication failure. Many safety checks that healthcare systems have in place may not work as they should and cause avoidable harm to the patient. It is now well recognized that the patients too can play a significant role in minimizing this avoidable harm. So with this purpose, we are conducting this session for this year. Already we have completed almost only 2 months are there. Two chapters are yet to be done. Every month we are doing it. That is the Karnataka and Maharashtra chapter left for this year. And just I would like to mention that as ANEI also doing the annual patient safety conference, this is the 4th annual patient safety conference will be held that is on the 27th of September. And all of you can go to the ANI website and you can log into it and register it and get the benefit of it, and visiting the place Bangalore and learning from these learned people and excellent people who are master in this subject. So these are the people, or not only the speakers, the eminent speakers. We also have, the who all underwent the quality project under the stewardship of Madam Thankam Gomez, the quality improvement projects. Those people will be there as a speaker, and also eminent people as a panel in panel discussions. So please don't miss it and hurry up to register over there. So with this, I'm winding it up my welcoming speech to you all. Wisdom is not a product of schooling, but of the lifelong attempt to acquire it. So I welcome you all for this Empower Our Kerala chapter and wish all the best to the Kerala chapter. And with this, I would like to welcome Madam Captain Ajitha Nair, National President of ANEI, to address the gathering. Ma'am, over to you.
Good morning, everybody gathered over here, and thank you, Dr. Unmana, for inviting me. I'll just take 2 minutes or so. You have heard about ANEI from Dr. Unmana, and that is a minuscule of what we are doing. Actually, the description is due to paucity of time. We could not say it all. So I would request everybody to be actively participating in ANEI for the sake of patients, I would say, because our primary objective of this organization is to take care of the patient and to minimize preventable harm in healthcare is one of the most important objective of the existence of ANEI. And in the series of we this year thought of involving patients to hear from them, who had undergone some mishaps or, unpleasant outcomes from healthcare. All of us know that healthcare, nobody is playing God, and there are inevitable outcomes. But despite that, we do believe that preventable harm to patients can be minimized and can be brought down to zero. This is our commitment to healthcare, and nobody can do it alone for that matter. And everyone who is working in the hospital, including all categories of employees, not only the doctors and nurses and other clinicians, but also everyone who is working in the hospital has an important part to play in ensuring the safety for the hospital and ensuring that we bring down the preventable harm to zero. So with this objective, we work every day, and we need more people joining us with this objective to go forward. And we only realize that how much more we do, we only realize how little it is, considering the impact of, or considering the size of the problem. So we need more people joining us in this mission, and that's what I have to tell you as president of this organization, and I can ensure the commitment of ANEI towards this objective. Back to you, over to Manju to take it forward. Manju is our Kerala chapter president, and over to you.
Thank you, ma'am.
Thank you, Unmana madam and Ajitha ma'am. Good afternoon, everyone. Evidence show that when patients are treated as partners in their care, significant gains are made in safety, patient satisfaction, and healthcare outcome. Today, ANI Kerala chapter proudly presenting an exciting session on engaging patient in maternity care. It is my pleasure to welcome the audience to this learning session, and I am sure you all are eagerly waiting for this inspiring journey with us. To elevate the voice of the patient, we have a guest from patient family, Dr. Akhil S. Karun, who is an assistant professor, Cochin University of Science and Technology. I welcome you, sir. We are really excited to hear from your side.
Okay, thank you.
Next, Dr. Radhika, Associate Professor, HOD, Neonatology, Sri Avitan Tirunal Hospital, Government Medical College, Trivandrum. She is an external assessor for NQS and Muskan. A huge welcome you, madam, to this dynamic panel discussion. We have another panelist, Madam Sai Bala, Director of Nursing, Amrita Institute of Medical Science. I welcome you to this inspiring journey as a panelist, ma'am. Next, I welcome Ms. Neetu, Nursing Superintendent. She is handling the quality and digitalization the last 12 years in Rajagiri Hospital, Kochi. I welcome you, Neetu.
Thank you.
Last, we have a Professor Elizabeth Berkey. She is performing dual role in Baby Memorial Hospital as Professor and HOD of Pediatric Department and CNO of Baby Memorial Hospital. And she is an NABH assessor and our Patient Safety Fellow. I welcome you to moderate this session.
Thank you, ma'am.
So once again, I welcome all the participants to this and the panelists to this program. Without waiting, I will hand over the platform to Professor Elizabeth Berkey. Thank you.
Thank you, ma'am. Thank you so much for welcoming me to this panel discussion. So I think I'm audible.
Yes.
Okay. Thank you. So you all know that patients are often referred to as the third eye in healthcare, especially their relatives, offering a unique perspective that professionals may overlook. So by actively involving these patients and their families in safety protocols, we unlock an extra layer of vigilance that is creating a powerful alliance that enhances care and prevents errors in real time. So engaging patients in their maternity care is essential to ensure positive outcomes for both mother and newborns. So warm welcome to one and all to this panel discussion on engaging patients in maternity care. And I hope and wish that this session will definitely be full of insights and learning. So as Ms. Manju said, we have a very special guest, Dr. Akhil, who has been to a healthcare organization with his wife for a safe confinement. I think we'll start this important eye as a relative of the patient. So Dr. Akhil, being the role as a bystander, especially awaiting to see the newborn angel and the anxiety that you might have undergone outside the labor room, you might have thought of certain good practices that you wish to have being an anxious father or a relative. Can you just throw some light on this? Over to you, Dr. Akhil.
A very good afternoon to one and all. Certainly the question was a very important one. So waiting outside the labor room as a bystander, particularly as an anxious father, can be a challenging experience filled with a mix of emotions. And here are, so I thought that, so when we were there, I am just remembering the incident. So we were two people were there. So when I am standing outside, so in every instances, any turning point is there, the healthcare professionals are calling me and passing the informations to me in every 2 hours or 3 hours. It was okay. It was good. But when it was admitted, she was admitted, they were not allowing me inside the labor room. That is one part. And also, I know the hurdles which the healthcare professionals are taking, or what risk they are taking, and maybe some needy ones will be there. So even though, so I would regular updates from the medical staff. Having a designated person to communicate any news can provide our reassurance and help keep everyone calm. And also the environment. So we know that the hospitals are crowded with many people and with many different derivatives of illness. So the mentality of the patients and along with the also with the bystanders are not that good at that time. So the environment also must be a favorable one to talk or to communicate with the healthcare professionals freely. So this is the thing what I felt during my my thing with my wife during the hospitalization period.
Okay, Dr. Akhil, that was very enlightening to see that the outside labor room will be an area where the anxiety score will be high if you just rate them. Or if you have some instrument to measure that, I think that will blast also. So thank you for the contribution. So over to Dr. Radhika. As a neonatologist, you will be aware about the situations in a labor room. So nowadays, some hospitals provide provisions for presence of partners, as Dr. Akhil already mentioned, in the delivery room. What do you think might be the benefits as well as the challenges if we allow them to be present during the labor?
you. Thank you. Am I audible?
Yes, yes, ma'am. Proceed.
So now, gone are the times when the mother is pushed into the labor room and the family gets no news of what is happening until the baby is delivered. So now, world over, we are moving towards family participatory care and involvement of the family as much as possible in all aspects of medical care. So the pros of involvement of a spouse or a family member in the delivery room is many. So we have found, especially in public health sector, the government sector, there are a lot of limitations in allowing all the family members. Of course, you cannot have a private suite or a separate area where the whole family can be present at the birth, like it is seen in most of the Western countries. But still, changes have occurred over the time, and we found that having a person who is a family member, it can either be a partner or spouse of the lady, or it can be any other female relative of the mother's preference. Now, we have found there are a lot of benefits. This person who we will name as a birth companion should be counseled before the delivery itself. So, because they can be prepared on what they are expected to do and what they are going to see once they are in the labor room. It should not be somebody. So, antenatally itself, the birth companion should be selected and they should be counseled and prepared on what is their role when they are in the delivery room with the mother. And we have seen that maternal anxiety levels have come down a great deal once the familiar family member is with them. Ideally, it should be, like Dr. Akhil has said, it should be the partner or the spouse, but still there are constraints in allowing male members into a crowded labor room in many public health sectors. So many times it's a female, a relative, either the grandmother or any other sister or some adult female member of the family. So it helps in reducing the anxiety, improving the patient satisfaction. Regular updates regarding the patient's condition can be given, and they can also help along in allaying the anxiety of the mother. And also, once the baby is born, the baby needs to be put to skin care and also to initiate breastfeeding. For all this, sometimes the staff may be busy with other work. So if a relative is there with the mother, they can help in all such care and the bonding as such will increase. So these are the pros. Having said that, cons are still there because medical staff are still a little bit anxious and jittery when family members are present. We are worried about a breach of confidentiality, breach of privacy. And sometimes if the birth companion is not well prepared, they himself can cause problems and anxiety within the labor room. So, but definitely the pros are more than the cons, and we should actively involve a partner or a family member as a birth companion because it will go a long way in improving patient satisfaction and allaying patient anxiety.
That was an excellent response, ma'am. And I have seen that many of the reviews have come up with evidences that if the partner is accompanied the labor room for a parity one or the first baby, the second, they will not allow for the second baby because of the anxiety that they have encountered. Okay, it was an excellent thought, ma'am. And now to Bala, ma'am. Coming to a nurse leader with a vast experience in clinical as well as administrative role, you may be familiar with the concept of patient advisory council, an initiative for patient engagement, and many hospitals follow this. So can you brief on the process of this patient advisory council as well as the pros and cons of such advisory councils? Over to you, ma'am.
So there have been this whole concept of having a group of patients on your board. They are voluntary patients who actually are willing. So the first thing about it is to choose the right kind of people who can give you constructive feedback on the patient experience. Because what happens is when you are, though we are also have become patients in at some time in our life, especially in the maternity side, most of us are females in our profession. Even with all that experience, our view about certain things are very different from a layman's perspective in the sense. And now with the more evolvement of the Google era, where everyone goes back to the Google to find out what experience other people have and to get prepared oneself. And with the less and less of social engagements in the families, like, you don't have nuclear families, you don't have very close relatives with you. So you don't really know what to ask to whom. So you Google out a lot. And you learn a lot from the Western countries and what has been followed. We have lost our culture and our whatever setup is within us. So there is a lot of things that actually will be a kind of limiting or probably giving a different perception to the experience that we encounter. So patient advisory councils were built where there was literally a lack of involvement with the patients, so that the patient experience can be heard and understood in designing the hospital or the healthcare facility to getting the feedbacks, getting them in quality improvement projects. And it actually has a tremendous impact on how healthcare actually delivers a better patient experience, because the overall healthcare experience is actually reflected on the patient experience of what they go through when they are in the most difficult time of their life. So this advisory council, the advantage is that you will definitely in get a different perspective in the sense on, like in example, if you look at the labor room, that you want to allow a partner, you need to design it in such a way that the privacy is protected. Okay. So these inputs from the patient advisory council would be very beneficial for you. You want to design a feedback. As healthcare professionals, we have something, but the patients will have a something different to say to us. So we don't know what kind of questions to ask. So these people can get engaged in developing these patient feedback questionnaires, addressing sometimes addressing concerns. Like you have a team of people who are actually from that different background, like they talk from the patient experience. So these people will become like your counselors in times of need. When you have a legal issue, when you have an ethical question that you want an answer for, they can actually add on. You want a project like a QI project where you're looking for an enhanced patient experience, especially with a delivery partner. In whom do you decide, the female or the male? What kind of design is required? And do we allow them? How do we train them? How do we prepare them? So these kind of things, the patient advisory council can play a very, very good role. And in a setting like in ours, when there's a tertiary hospital or bigger hospitals, the advisory council may not be one, it might be many, based on the specific needs. But in a community center, like if we are moving on from a major tertiary hospital delivery system to a very public health, primary health level delivery system, where you want minimal interventions, you have a normal labor with any different kind of positions available of their preference. So you want the whole labor and delivery experience to be pleasant for the parents, so that the engagement with the child begins with a very sweet tone. So that's the whole purpose of moving that into the community within the social setup. So in that case, the advisory council can play a very good role, because the community engagement and the overall safety of the mother, father, the institution will benefit a lot from this. However, it's important is that to choose the people, the how to choose, whom do you choose, what kind of people do you engage, what kind of training do you give them. You have to have expectations being listed out very clearly. So if you want to have a guide on how to do that, there is a guide which is available in the AHRQ website. There's a book on how to prepare this patient advisory council, but it's a purely American thing. We have to Indianize it based on our concepts. But there is some kind of a draft which is available. Anybody wants to try that out, there is a welcome thing. But we have tried a lot of that in many of our hospitals, and I'm sure that the outcomes have been tremendously good, because the small things of life which get missed in the vast ocean of healthcare will definitely get picked up, and that improves the experience of the patients tremendously. Compared to a very skillful doctor and a nurse, the small details of having the best comfortable bed, the best immediate access to a baby dress, or somebody to hold a hand, those kind of things, and ambience that he is talking about, the ambience, how that ambience would be, so that it makes this whole experience a much more, a sweeter one than one of an apprehension. And
See,
that actually will also impact on the baby's health in another way.
yes, ma'am. Excellent enlightenment to that area. But I think nowadays the patients are the smart customers, and they refer the Google doctor, and they come up and they will be having more ideas than any of us. But only limitations that we have to emphasize their tertiary into the administration aspects. But very good, ma'am. It was an excellent thought you have given us. So moving on to Ms. Neetu, being a healthcare quality professional, what are your thoughts in improving quality by engaging patients or relatives in their care, especially in this obstetric area?
Thank you. Good morning to everybody. So before proceeding, I'm just listening to everybody. So I have heard from the patient aspect from Dr. Akhil. I have heard from the doctor side from Dr. Adhika, and Sai ma'am has actually given a very enlightenment on that what perspective a person as a patient is expecting and as a hospital. So of course, quality is very important when it comes to patient safety. Every patient wants a qualitative care wherever they are going, a corporate hospital, whether they are going a government hospital. But being in a corporate hospital, the patient engagement is more higher than comparative to the government sector, if I say. The reason why, because here the patient-centered patient's voice is matters a lot. So with reference to that, of course, for effective communication, we need to have a patient communication with the healthcare provider so that we can understand the patient relative can understand that of course the mother is in safe hand and the plan of care is very much understood by them, that how the things are going to flow. It will be very efficient for giving a shared decision making, because patient can give their choices, the family as well as the mother can give their choices to ensure that the preferences and values of their particular religion or uh, the circumstances can be taken up care. Because India is an incredible country, so we have different beliefs when it comes to a newborn baby. Everybody have that factor of Indian beliefs that we supposed to get the baby in this way and that way, and so many things has to be taken care while we are taking up. Coming to the early consent identification, which is very important when it comes to healthcare sector, because as a part of administration, I knew that the concerns need to be addressed at immediate basis. So the patient should not go with the negative impact that the hospital has not taken care well or something has been lacking. Of course, it's a human based, everything is there, errors and things will happen. But of course, the concerns whichever raised by the patient is actually give you a improvement plan that we can proceed further. Patient education, the family's knowledge towards the procedures and options to getting an different options and getting to know about that there are available different options for the delivery as well as coming to the care. It actually satisfy them, and it will give a clear picture that the hospital is transparent when it comes to patient care. So definitely patient engagement and family engagement is very important, including the spouse or a female person from the family, which actually help in patient side. If I say, the anxiety of the patient will reduce. Of course, some family and relevant faces there in front of them while this complicated situation, but it's also give an anxiousness to the healthcare providers while they are tackling that. But definitely the engagement gives a more impact of giving a better care and a quality care to the patient.
Okay, thank you, Nitu. I think there are various scopes for having quality initiatives in this maternity area. So, well, going back to Dr. Akhil, I think your wife had LSES. So, can you share how you were involved in the decision making? As initially they might have tried for a normal parturition, but due to certain indications, she had to she has been taken for LSES. So, can you please brief on how they engaged you in that decision, and also if you have found some lacunae, please come up with your perspectives.
Surely in the situation where my wife needed to undergo a lower segment cesarean section, after initially attempting a normal delivery, I found that some effective communication was very crucial. So the healthcare team engaged us by providing clear explanations about the reasons for the shift in the approach. So not only that, so we had admitted, she was admitted in February 16th and initially tried for 5 days for normal delivery, but it was not happened. And the doctor and the immediate junior doctor also called me in a cabin and explained me. The senior doctor was about to wait for the normal delivery for some reason, but the junior doctor, she was continuously looking from the beginning. She was informed that she had a gestational diabetes from the month of 30 or 32. They were from the 32 weeks. So the senior doctor also told me to it is not good for waiting. So it is let we have the surgery. Okay, even though I have been communicated, so I find some area of improvement. And after that, also one PG doctor came to me and showed the document, the agreement, and I have signed it. So it is also if we have the informed decisions, that means the medical staff explain the indications for the lower segment cesarean section and discussing any concerns that arose during the labor, and or they provide details about the her condition and the potential risk and benefits of continuing with a normal delivery or opting for a cesarean. So also providing a more informed decision or involvement in the decision making process. So they have invited me to ask questions and expressing my thoughts or my family members' thoughts. And this inclusive approach helped us feel more empowered in the decision making process. I appreciated their transparency, which allowed us to weigh all our options and consider the best course for both my wife and our baby. So I find some lacunas in the area of emotional support since the hospitals are much crowded and they have to look after other patients also. The healthcare team was sensitive to the emotional aspects of this decision. They acknowledged our concerns and provided reassurance in some areas, which was invaluable during such a stressful situation. But then I find some difficult situations also from the replies from the healthcare professionals, especially from nurses and doctors. But I will come to that later. While the overall communication was good, I did notice that some of the medical terminologies was used was a bit complex, and simplifying their language could have made it easier for us to fully grasp the situation.
Yes.
So also additionally, I would have appreciated more proactive engagement from the team in discussing potential scenarios earlier on, even before labor began to better prepare us for any necessary changes in the delivery plan.
Yes, sir. I really agree to what the concept that you have shared. And one more question to you itself, whether the health team member allowed you to talk to your wife before the decision was taken to take her to LSES.
So before the decision was taken to me, she called me in a couple of times, but we met her and talked to her. But immediately when it is approaching to the surgery, they were not allowed me inside. So after the decision making, also if they are allowing me, that is better. I think there may be some constraints. I am not complaining that, but it would be better.
Yes, excellent. And that was a real thought-provoking area because the emotional aspects has to be taken care of. So thank you so much for that view. So dear Dr. Radhika, being an entomologist, if you identify that a newborn is having asphyxia and need to be resuscitated and shifted to an ICU or neonatal ICU, how do you involve or counsel the parents in decision making?
Yes, this is a very important difficult situation that we face most often. So because pregnancy is supposed to be a happy time and everyone wants a good outcome. So if it is a high-risk pregnancy, we do counsel them antenatally and tell them there is a possibility baby may require some help. But sometimes we see, to our surprise, that even pregnancies that are going normally till then, at the last minute, at the time of labor, there might be some difficulties causing the baby to have asphyxia or come out not crying. So it's a very difficult situation. The family is in shock because they are expecting a normal baby. So while the team, there is an experienced pediatrician who is in the labor room to take care of the baby and start off with resuscitation. At the same time, the family needs to be updated on what is happening to the baby. So we do counsel the family, the immediate family, that the baby is requiring some help for transition. Baby needs some extra help for breathing. And some reassurance that the medical team, resuscitation is ongoing and the medical team is doing whatever possible. But at that time, we may not be able to give further news because everybody is involved in resuscitating the baby. But just a brief news that something wrong has happened, something that is unexpected has happened. And so the team is doing whatever is possible. And as Dr. Akhil has correctly mentioned, it is very important that we use simple, non-technical language. Sometimes we medical personnel get carried away and we are used to a lot of jargons. And we talk to patients with the understanding that they are understanding. So it is always important to tell them, have you understood, or ask them to tell back at the end of the counseling. You can ask them, what did you understand from what we have counseled? So many times they might be a shock and they may not be able to comprehend too much of technical jargon. So we do try to, but sometimes fail in keeping our language simple and as jargon free as possible. We also tell them whether the baby needs admission. Sometimes babies who have asphyxia may require admission to the NICU. They will require ongoing monitoring and regular updates should be given, and we involve the family. Daily counseling sessions are arranged for the family in the NICU, and involve them in the medical care and plan of the baby. So we have to be empathetic to the family. We have to address their concerns and queries, and at the same time, we have to communicate and document all the communication, because many times we have medical legal issues as well. So whatever we have communicated has to be properly documented as well.
Excellent, ma'am, because the thing that you have emphasized about the written narration of what you have said, it's an excellent area. Like we often does not take care of that particular area, because during the time of anxiety, they will not be able to listen what you are saying. So narration of the things which you have explained is an excellent thought you have come up with. So coming back to Bala, ma'am, we know that while caring patients, there should be a holistic approach by taking care of their psychosocial, spiritual, and emotional needs. You being a wonderful and exuberant personality, crowned with all the aura of holistic well-being, I think you will be the best person to answer this. We have heard about maternal postpartum depression, and we take many preventive measures in helping them. But less importance or awareness are there among the health professionals or nurses on paternal postpartum depression. Can you please enlighten us with some thoughts of education or counseling in order to prevent this paternal postpartum depression? Over to you, ma'am.
That's a wonderful question, Elizabeth. What happens is when it's about labor and delivery, we think about the woman and the child alone. A lot of the time, the father get missed in the picture. And in the earlier times, we had this. If you look at the Indian culture, we had a different rituals that was happening from the time the women is conceiving. So it's a constant reminder that the role is changing. You are becoming more and more responsible individual. You are actually supposed, and you have a lot of men gathering in the family too, along with the women. So there is this preparation that goes on without really being, this quote unquote preparation that you talk in the hospital. It starts with the family, which is missing nowadays because we have actually lost all those connections. So the preparation is about the women is less, also the men who are actually becoming fathers is less. And what happens is in the women, if you see the postpartum blues happen soon after delivery, in the men, it happens later after 6 months to 1 year. So in Indian setup, at least even now, the women after delivery goes back to their family, and it is a maternal home where they are actually there. So basically, your adjustment levels with every other person in the family is less. So your stress levels are less. And the father is left alone to ponder about his roles in his own safe place, where he belongs, where he's actually been belonging for a long time. So you have each other, the time to cope up with your own, change in roles, to come back and unite together after 6 months. But when the whole, the joint family system has gone and the parents are alone, and the wife goes after to the delivery soon to back home, husband and wife alone with a kid, the lack of sleep affects both. And especially when the man is working and coming back, even though you have a caretaker at home, and with all the negative in the social media and other sites which are influencing and telling you that there's so much things bad happening, you have a worry that is inside you all the time. And more so happens when there is a prenatal problem, when there is a relationship issues between the wife and the husband, there is a prenatal issue, there has been a very turbulent experience of delivery itself, the overall social support system is lacking. And even with all this, even if there is just a lack of sleep and the stress of the work together can cause this depressive features in men, which are often not addressed. So the preparation for the mother and the father should begin in the antenatal period itself, if not in the society, at least at the hospital. So the healthcare professionals should be, sensitized enough to understand that. So it's also a good practice to have whenever you have this breastfeeding week, when you have this antenatal, this maternity week and all that, to involve the fathers in grooming, in sharing their experiences, in covering up a baby, being part of the care. So this is some activity that can get involved in the hospitals, where people can actually bring in the parents also to be a part of this. And I think in nursing, especially if you have male members doing the counseling for the fathers, would be much more effective, because they themselves have been fathers, and who has been gone through this experience would be in a very good position to explain how the psychological support that is required for the parent to become a father. It's a
Yes.
very turbulent experience, both for the men and women. But often we feel that the men have not delivered, so they don't have any stress, which is very underestimating fact. I think that is something that we really have to take care. If you look at the holistic health as an inspective, right from the culture at home, in preparing, like in Indian culture, there are different scriptures which talk about getting prepared for delivery and getting prepared for the conception. So from the time of conceiving itself, the preparation needs to be starting
Yes.
for the betterment of the patient, the baby, the mother, and the father.
Yes, ma'am. Thank you so much for that extensive, comprehensive care that we have to extend to the fathers also. So coming back to Ms. Neetu, we have been seen in certain institutions also in patient rooms, a caution saying the family members or bystanders are hereby requested to ensure that all health professionals touch their patient after hand washing. I often feel that is a real third eye. So can you share a successful quality improvement initiative that directly impacted patient safety in the maternity ward?
Surely, like coming to the quality initiative, it is just not the job of healthcare professionals. Of course, the family and the relatives who's coming and visiting the patient, they're also completely involved. So both the things will work in two directional. One will be the way that we are communicating them that hand washing is very important when it comes to touching your own patients. So whether it is trust by the healthcare professionals or whether you are dealing with your own relative or the baby, you need to be very careful with your hand hygiene. Yeah, of course, everybody will be very cautious when it comes to your own family. So with that also other initiative like enhancing the prenatal education program. So as Dr. Adhika ma'am was stating that educational program for dealing how to deal with the situation and all those involvement of newborn care and empowering them and understanding what is expected from a mother and the preparation. As Saibala ma'am also rightly said that, of course, the preparation is very important when it comes to a newborn is coming up. So mother or a father both need to be prepared from the conception site itself. Breastfeeding support services, this is one of the initiative usually the hospital takes up, which is related to we are storing up the EBM, the exclusive breastfeed, which is stored for up to 6 months, and that will actually help for a working mother or the baby, if it is admitted due to any complications, can be getting a mother feed itself. That is one of the factor. And also some of the hospitals are having the lactation nurses or the lactation consultant, which actually guide the mother that how to go forward with the breastfeeding, as well as the latch assessment, that the technique how to feed a baby when they are lying, when they are sitting. So these different techniques is basically informed by that particular expert nurse or a consultant. Family centered care model, where of course as we all are talking about the patient engagement, the family engagement, it is very important that how the care gonna flow from hospital to home. So that process where we can include and participate, can involve the family members to have a better care that they proceed in the home. Then coming to quality improvement collaborative, like the collaboration right now, we all are coming from different hospital healthcare setups with different experiences. We usually can give a better outcomes which we achieved through our different initiative, which is helped out to have a better care to the patient, as well as to manage this such situation where the complications restrict us to take a new step. So of course, new initiatives usually help us to understand that. And one of the best factor which actually I gone to a different hospital is having an emergency response drills. That is especially for the quality initiative for the mothers, where they are having a collapsed maternal, that is called code 1 and code 10, where they are managing the full-term mothers during the collapse situation. So these are the few initiatives which basically helps to improve further in maternity care.
Excellent quality initiative that is you have thrown light onto. So coming back to Dr. Nikhil, I think as you have got a very pleasant experience for your first baby, definitely you'll be planning for a second baby too. So how do you believe healthcare providers could better involve families in maternity care to enhance safety and overall experience? Doctor?
Yeah. Of course, the family members play a crucial role in ensuring both the mothers and babies' safety during the labor and delivery. And I would like to throw some points on it. So the first thing is regarding the emotional support which we can provide to the lady who is delivering. So providing emotional reassurance can significantly reduce stress for the mother, and family members can help keep the atmosphere calm, encouraging her and offering comfort throughout the process of labor. And the next thing is, so that is the lacuna I told you before the cesarean section. It was she was not shown to me. That was one thing. The next thing is family members can act as an advocates for the mother, ensuring that her preferences and concerns are properly communicated to the medical team. So this includes the discussing her birth plan and any specific wishes regarding pain management or any interventions. So in my case, my one of my relative was there with her. And she was continuously calling the healthcare professionals there, but they were reluctant to help because of their professional busy or anything. But continuously, one instance was one PG doctor was there, so she was put with the for getting that pain. The tube was fitted, and she was continuously bleeding. And they informed there she informed through her relative to the nearby PG doctor, but he was not attending to it. And his claim was this is not his claim, this is not his unit, so you have to wait. So ultimately, the patient is suffering from this kind of activities, and they were waiting for half an hour to get a doctor to them. So next thing is the informing the information gathering from the family members can assist by asking questions and seeking clarification from healthcare providers. This helps ensure everyone is informed about the situation and any changes in their plan. And also the other thing is if all the physical support, like the mental support, all the physical support has to be provided to the mother. They're helping with physical comfort measures such as providing massaging, holding hands, or assisting with mobility can engage mother experience and contribute to her overall well-being. So in my case, after the delivery, the baby was shifted to the ICU due to the lack of sugar, since she was suffering from gestational diabetes. So immediately after the first day, the baby was shifted to the ICU. So the floors were spread in 2 or 3 floors. She has to move from the ground floor to the third floor. And at that time, we informed that she cannot move from here to there. And if there are any wheelchairs are there, we can bring her to there. So for feeding the baby.
Yeah. So Dr. Akhil, you were telling that all the services has to be aligned and should be nearby. And
yeah. So if it is nearby. Otherwise, if the nurse who is assisting us told that there is no enough number of people to take her. So at that time, my brother was there. He was telling that he could able to bring her to there if a wheelchair is provided. So even a wheelchair is there, they are not ready to give to us. That is one problem.
That was an excellent, that was an excellent contribution. So can I just go to Dr. Radhika as we have running short of time?
Yeah, sure.
Radhika, can you share an example where patient and family input helped avert a neonatal complication or helped in identifying an early warning sign?
While we are discharging high-risk babies from our wards, we get them prepared because many times we are forced to discharge. We don't have the luxury of keeping them for a long time. After 48 hours, the mother and baby do go home. So, and probably the next visit to the hospital is at 6 weeks when they come for the first immunization. So the parents have a lot of questions to ask. So while we are counseling the parents, we tell them what to look for. There are certain danger signs that have to be looked for in the baby, and they are supposed to bring the baby back if they find any of the danger signs. On many occasions, we have found babies who the mother has reported to be too sleepy or not as active as the baby was the previous day. So this is one of the common signs that we see in neonatal conditions like infections or sepsis, and also when there is a low blood sugar or hypoglycemia. So if the mothers wait too long with this condition, it can lead to severe mortality or morbidity. So we have had mothers who I understand that a baby who is not feeding well or is sleepy for a longer time and can be brought back. If brought back on the right time, we can start the appropriate antibiotics and control the infection. And another thing that we find in a danger sign is we tell them about neonatal jaundice. So if there is any small amount of yellowish discoloration is normal for every baby. But if they see a yellow color in the palms and soles, it's a sign of severe jaundice. So one of the danger signs that we are told is you don't wait for that. If you see, and the other day also a mother was brought the baby, they had itself requested for an early discharge, and we had told them that if you find the baby's jaundice, you should definitely bring back. And the next day they found the jaundice was progressing, and the baby had to be brought back and had to be started on phototherapy and had a very high bilirubin and actually required exchange transfusion. So if the mother had waited for another extra day, then probably we know that delayed recognition of jaundice can lead to kernicterus and brain damage. So these kind of information should be given to the family at what are the danger signs and when the baby should be brought back. If they don't bring the baby back in the right time, it can lead to danger. So these are the danger signs that we explain.
Thank you so much, ma'am, because that is a eye-opener for every parents, because if you educate them properly, we'll be able to identify certain complications at the earliest. So back to Bala, ma'am, how do you train and prepare the nursing staff, because they are the workforce which are involved in patient care? How do you involve the patients and their families in decisions related to maternity care? So how do you train them? How do you train and prepare the nursing staff to involve patients and their families in decisions related to the maternity care?
Basically, I think it's a part of our continuing education program. So it's a culture also. It's not like one-time training is enough. It's also a culture to have patient feedback heard, have a structured feedback, the feedbacks being discussed. Any patient experience, like we talk about incident reports when you have something that is unexpected, but we also have to talk about where patients actually express their grievances to someone in the health team. So how to pick up those things and bring it up to the board, either to your superiors, report it so that you can have a system in place. So basically there are two things. One is personal engagement with this thing. Easier is to have a continuity in care rather than people shifting, because the parents find it very difficult to have that connection. So it's not very much possible during the late working hours where you don't have a senior person in charge, but having an introduction to each other. So these are some soft skills along with the regular labor and delivery science that we teach. The art of connecting with the parents is something that we have to do, and it's more of an experiential learning than a didactic lecture on online, which is not possible for us. One is that you have to have a basic orientation system, induction system, where you actually prepare the nurse right from the beginning, the day one, how to engage in every single activity that you do. It's not like a patient engagement is a separate topic. Second is, once you're actually on board, so the initial days, every nurse is very comfortable with the processes because they want to learn. So they are actually getting it. But after a period of time, like after 1 or 2 years experience, they feel that they know it. And that is when you have the falling off from the policy. So they kind of feel and assume that people know, and it's okay not to go and communicate every small thing or pick up and inform. You have a connection between two healthcare professionals. So somebody said there's something that's not very healthy. You don't want to report it because you feel, you can talk to each other and sort it out. So those kind of things, I think that is the middle level training that you need to give, that by the time when you're 1 or 2 years, you need to be sensitive enough to pick up the information, and you are the advisor for the patient. So as an advisory or an advocate, basically, for the best patient experience, you need to highlight. So the training shifts from basic sciences to much more of picking up the signs and communicating, going back and highlighting what is not right, and how to pleasantly handle the crisis,
Okay,
because
okay,
you're
ma'am.
very, very junior level people who are leading the team. So
Yes.
this is something that's very important, that you have to focus now on
Yes.
changing empowering the nurses to do this, and a feedback system and appreciation and acknowledgement. Anybody who does a positive behavior need to be acknowledged and appreciated, so that the behavior actually gets reinforced.
Yes, ma'am. That was an excellent thought, like for the induction, starting from the induction to the privileged communication you have thrown light onto. So finally to Ms. Nitu, a last question. Can you just name one strategy which you felt that was most effective in reducing safety incidents in maternity unit?
Okay, so there are a lot of strategies, but of course, as you said, only the one which I say, that standardization is very important. Like coming to the training, of course, it is effective training when you do a standardized process training, like and moving towards that same standard of checklist and the processes which is involved there. It's easy for the nurses also to adapt it, and the other healthcare professionals to move with that, so that
Yes.
any deviations, any errors is happening around it, it can be taken up as a learning and can be improved, and it should be reported.
Okay,
The
thank you so
but
much.
most important one part just started to add to it is the audit. Audit is important when it, of course, sometimes we are just talking each other and just we resolve it, but of course the audit is the third checker which can help us to improve further. That's from my side.
Excellent contribution. So with us, we are concluding a panel discussion. So we have the experts also here. So let me ask any of our leaders, Aji ma'am, Tangam ma'am, anything to share?
If anyone has any question also, like
I have already typed the question to Elizabeth. So my question is that today's date, we all are struggling with young nurses wanting to perform the best everywhere, and we don't have time to train them, and they are under pressure because they are just new into the profession. So recently I had been preparing to talk on nurse navigators, and it is quite successfully used in other countries, and it is one of the most engaging engagement models. So my question was that, how about having nurse navigators in maternity care who are responsible from the beginning till the end, so they kind of become the companion for the would-be parents. I think that's a good model to look at when we are struggling so much with induction training and training and training. We want them to do all the safe things. All this, being a companion to the family. Maybe that's something we should consider, because I was reading a lot on that. I have seen about this in Singapore and Malaysia, and they work hugely well, and they're expected to be clinically very, very sound, apart from having fantastic communication skills and empathy and all that other attributes. I just thought, I'll just ask the panelist, any thoughts on that? What do you think? Should we be considering?
One from Nurse Navigator. I think, ma'am, it is a real great concept, because actually we have many attrition rates also. If we have a designated people for that, it would be a great contribution to the patient safety as well. So anyone wanted to add all this?
So I just wanted to add to this particular thing, that nurse navigator is majorly is the holding hand and showing the way. Navigator always show the way, that it's showing, it's going in a right, the ship is going in a right direction. Of course, the mentor is kind of a role they play, and they can help the nurse to understand the process, because it's day to day you have a different challenges which need to be addressed. And today we have done a training, there will be a vast thing which is updating tomorrow. So that definitely gonna help each other to understand better and to provide a better care to the patient as well.
Okay, thank you so much, Tangu ma'am. Can I ask Aji ma'am, you have anything to say?
Thank you, Dr. Elizabeth. Well conducted Empower Hour session. Congratulations to the organizers and all the panelists and the moderator. Thank you so much. Such an apt topic as we talk about respectful maternity care in every moment. And as just now Ms. Neetu said, the navigator role. a birth, and Tanga madam also said about the birth partner support. Why not the family member? The best approach for giving a respectful maternity care. Nothing more to add. It was a wonderful session. Thoroughly enjoyed. Thank you.
Thank you. Thank you so much, ma'am. So to conclude, there's relatives as well as the patients, as I already mentioned, are the third eye. So we have to have a watch on them. They are definitely going to catch us in all the things that we commit or the errors that we encounter, or the errors that we give to them. So engaging patients as a maternity care not only enhances the childbirth experience, but also promotes safety, satisfaction, and better health outcomes for mothers and babies. So we have to personalize care, education, as already mentioned about the emotional aspects to be undertaken. All these are important areas, and already Tangama mentioned about the nurse navigator. All these are some of the take-home messages, and the patient advisory council. It contributes much to the patient safety. So thank you so much for your patient listening, and thank you to all the panelists for your wonderful contribution and making this even a